This video is on scar revision. So a scar revision essentially is cutting out a bad scar and making it harder to see. There are many ways to do that. I can talk to you for hours on scar revision, but I want to talk to you about what I consider the gold standard of scar revision, which is the geometric broken line repair. So essentially, the reason a scar is visible is the fact that your eye can pick up on it. It's usually due to the linearity of the scar. Now, if the scar is raised, elevated, a keloid, watch my keloid video. If the scar is slightly thicker, I may be injecting it to flatten it with something called 5-fluorouracil. However, if the scar is just visible because you can see it, and it's because it's a line, it could be depressed, it could just be a visible line going across, then we need to make that line hard to see. If it is an atrophic scar where there's a hole in there, like an acne scar, then I encourage you to watch my acne scar video because this video is not relevant to that. What this video is talking about are linear stellate, which means broken up lines or little depressed scars where your brain says, I can see these scars. So how do I make these scars hard to see? Well, let's talk again how our brain functionally sees a scar. If there's a line, we look at it, we say, oh, there's a scar there. So there are many ways to break up a scar. You can do a W-plasty, which is a regular W, okay? You can do a Z-plasty, which is to move scars around and rotate them. I almost never use a W-plasty because the geometric broken line is so much better. I'll explain to you why in a minute. The Z-plasty I will do in certain cases. The most classic example is the upper lip or some other areas where the scar is contracted. So the Z-plasty, the biggest advantage of it is it lengthens a scar. So wait a second, why would I want a scar longer? Because if the lip is contracted like this, or the scar is contracted here, I've got to lengthen it so that it works. But you're right, in most cases you don't want to lengthen a scar, you want a scar that's not longer. But in this case, the Z-plasty works better. Again, this video is really focused on the geometric broken line repair, which is just fixing a linear scar. So a linear scar is how our brain sees it. How can we get our brain not to see this? Because clearly, I can't take a line and make it completely gone. My goal is to take that line, and from a social distance, when you look at that line, your brain says, hey, I don't even notice that line. So my goal is from a social distance, 5 feet away, 3 feet away, 6 feet away, that our brain says, hey, I don't even see this person that has a scar. Now, when you're close up, if you're a woman putting makeup on, you may go, Dr. Lam didn't fix a scar. But that's not what I'm trying to treat. I'm trying to treat if you're having lunch with a friend of yours, having dinner with a friend of yours, having a business meeting, that they don't really notice your scar, or that has to be the harshest, weirdest lights to be able to see that scar. How do I do this? So, again, our brain picks up a line. So how do I make this line harder to see? The way that I make this line harder to see is I break it up. The W-plasty regularly breaks up a scar. My geometric broken line are little triangles, little squares, little trapezoids, and what's interesting is if the line is irregularly irregular, our brain can't pick up the pattern. And a W-plasty is too regular, so when it's a regular pattern, our brain will still see it. And so what I try to do is trick the brain to see the scar, and that's what a geometric broken line is. And I use tiny, like 2-3 millimeter, sometimes 4 millimeter little limbs, and under magnification, I'm placing these limbs together slowly across, and it takes me forever. It takes me oftentimes an hour, 2 hours, 3 hours to do a short geometric broken line. It's a very meticulous process under high magnification, because the more I can irregularize that line without making big zigs and zags, the harder it will be to see this scar. I oftentimes will close this incision with 7-ovicral suture. I've talked about this in my other virtual consultations. The reason for this is that stitch stays in for a few weeks, which oftentimes people say, oh, that will leave track marks, don't do it. It actually really doesn't. What it does is allows the epidermis to hold together, and so that incision doesn't split apart. And I found that the incisions heal so much better. I've learned about this through my rhinoplasty incisions. It's how I started doing scar revisions with 7-ovicral stitch. It's also, if you're fair skin, it's white color, you don't even see it. But what's interesting is in African Americans and Hispanics, because it's as thin as a hair, oftentimes they're not even bothered by the stitch either. And that stitch will stay there for 3, 4, sometimes 5 weeks. But that is what lets that incision heal so well. So that's another component, and a multi-layered closure. The other thing is I believe scar revision, just like a mole removal, is as important to talk about the surgery, which I just did, and again, I can talk for hours on that, but this is the basic idea, as well as the aftercare. So the aftercare is that scar is going to look worse. It's, let's say you had an old scar from 20 years ago, it's really well healed. Well, now I'm going to open up that scar and make it zig and zag and everything. It's going to definitely look worse for a while. Could be even for a few weeks, could be a few months, could be even up to a year. So my goal is to make your recovery as fast as possible, and for the incision to heal as well as possible. So what are things you can do? First of all, keep the incision moist for that first 7 days. Bacitracin, Bactroban, Vaseline, Neosporin, any of those things that Aquaphor, that can keep it super moist for the first 7 days. After 7 days, you're going to use silicone sheets and gels. In the lower face and highly mobile areas, the sheets are hard to place on there. Sheets do work a little better than gels. I've actually developed my own sheets and gels. And silicone works really well. You don't want things with a lot of fillers in there. You don't want things like Mederma that have onion extract, vitamin E, that water down the silicone. The silicone is the key ingredient to let this skin heal better. Again, I've developed my own product. So you want to keep it on for at least 12 hours. You don't want to be doing that prior to 7 days. And silicone sheets and gels in non-mobile areas like the forehead, you want to be doing that for at least for the first few months, and with sheets. And if you don't like to wear a sheet during the day, you can wear the gel during the day and the sheets at night. And the lower face, again, if the sheets don't stay on, you're going to use a gel. At least 12 hours a day for the first few months. 3 to 6 months, somewhere in that window is a really good time to be doing that. Other things that can help the scar heal well is Botox. I actually inject Botox into the scar. There's no extra charge for that if I'm just injecting the incision. That can really heal well. If the scar is on the forehead, I do charge extra. I would actually Botox the whole forehead, and what that does is the area doesn't move and the Botox is healing the scar. So Botox done a week before, a day before, can really help those scars heal better if you're not allowing the area to move. In fact, I had a lady that actually had a tree drop on her forehead, made a cut across her forehead. 2 weeks after I did Botox for her, I saw her a few months later, the scar was like invisible. So Botox can be another friend to help you with it. There's a study that was done where they did a split scar study where half of it was done with placebo saline, blinded evaluation. The other side was Botox a week after the incision, and 6 months later, the side with Botox was invisible. So that's really important, is Botox. Then other little things, dermabrasion, which is not microdermabrasion. I'm actually sanding down those edges to make the area harder to see, all included in the price of the procedure, is something I also do 3 to 6 months later on. And if there's a little bit of a denuded area for a few millimeters, you can wear a product called Oxygenetics, a makeup that's color matched for you that can easily cover up that area so that the recovery is pretty short if I have to do dermabrasion. Sometimes the scar gets a little thicker. I have to inject it with 5-fluorouracil. I mentioned that briefly for hypertrophic scars. If your scar becomes thicker, which is unlikely, I can inject a little bit of 5-fluorouracil with dilute steroids. You don't want to use high concentrated steroids in hypertrophic scars because it can cause dermal atrophy or loss. So scars, suffice it to say that the idea is to trick the brain from linear lines to harder to see lines, and good aftercare where over time all those little things that I'm doing are to me as important as the actual incision itself. And the final take home is, I mentioned briefly, is that I'm not going to take a line and make it 0. Okay, that's not what a scar revision does. The scar revision takes a line and makes it very hard to see from a social distance. So hopefully this video on scar revision is helpful for you, especially when you come in for consultation, because I essentially have been telling you everything I just told you.